biggest risk for most people with atrial fibrillation is actually the risk of strokes. Well, atrial fibrillation can cause symptoms. In about 80% of people, it's actually asymptomatic. And for them, the largest risk is actually having a stroke. And that's what causes most of the morbidity and mortality in atrial fibrillation. The biggest thing when you treat atrial fibrillation is to try and protect people from strokes. Right now, the main thing we use is blood thinners. The two biggest are Coumadin or the newer agents such as Xarelto or Pradaxa. And that is the predominant way to treat people for strokes. One of the issues with these treatments is less than 50% of people can actually tolerate these agents due to risk of bleeding. So in a large percentage of people, they're not protected from the biggest risk of morbidity and mortality in atrial fibrillation, which is strokes. Now we have a device called the Watchman device. Most of the strokes from atrial fibrillation actually occur from the left atrial appendage, which is a small outpouching from the atrium, where the blood stagnates in atrial fibrillation. This stagnant blood can subsequently break off and cause the stroke. But what the Watchman device is, it's a filter that we can now place on this left atrial appendage that prevents the blood clots from atrial fibrillation from entering the bloodstream.